by asking you just to state your name.
My name is Dr. Martha Goetsch.
And you are?
I'm an assistant professor of OBGYN at Oregon Health and Sciences University in Portland, Oregon.
And I am at the annual meeting of the North American Menopause Society, and I just heard Dr. Goetsch gave a talk that I think will be very important for a lot of women to know about. And it really has to do with?
It has to do with women who have severe postmenopausal symptoms of dyspareunia, meaning painful sex. And they are women who have had breast cancer, so they can't use estrogen.
So we have a group of women with breast cancer who can't take estrogen, they're having very painful sex, and you came up with a very creative way that you can overcome this problem. Let me ask you to just say what it was you were doing.
Well, because I've had a background of many years in a vulvar clinic that we have in Portland.
That's the skin outside the vagina.
Right, and specifically there's an area called the vestibule, which is kind of the inner vulva, and the vestibule has a capacity to develop a pain problem because of too many nerve endings, and lidocaine is a local anesthetic. It comes in a liquid formulation, and so after using it in examination settings for years, I felt like it would be appropriate to see if I could teach women who had this severe tenderness after breast cancer to use the lidocaine just prior to having intimacy.
So they were having pain in the vaginal area. They had breast cancer, but the pain was in the vaginal area.
The vestibule, not the vagina, actually.
Yeah, in the vestibule, the outer, the entrance to the vagina.
Correct.
And you came up with the concept of using lidocaine.
Right.
And tell me how that works. How did you go about that?
You mean how did I teach them to use it?
Yes.
Well, I've known from my examination experience that if you apply it for 1 to 3 minutes, you will eliminate the kind of exquisite sensitivity and burning sensation that touch produces. So I taught these women to use liquid lidocaine on either a set of cotton balls or large swabs, and they got those soaking wet with the lidocaine, applied them to the vestibule surfaces for 3 minutes, counted by, their watch or whatever. And then they applied lubricant, which we provided for them.
Then they take the cotton ball away.
Yeah, they take it away, and then they proceed with intimacy after using a lubricant.
So this is an approach using a 4% lidocaine in a dripping wet cotton swab that you put just on the areas that hurt, leaving it in place for 3 minutes. Then you remove that cotton ball, give some lubricant so they can then move on to intimacy. And it's only used right before intimacy.
Correct.
Is there anything, and what did you find? How effective was it?
Well, all of the women that we enrolled in the study had vestibular tenderness. And in my initial examination, it was reversible for all of those with the lidocaine. And actually that article is already published in the Green Journal in June.
That's the Journal of Obstetrics and Gynecology.
That's correct, yeah. So then we instructed them how to use this at home, and they either used saline. It was a double-blind, randomized study, so they all got lubricant, but some of them got saline for a month and were instructed to use it twice a week for penetration. The other group got lidocaine 4% for that month, and also they agreed to try penetration, and they could either have penetration with their partner, or they could use a tampon just to check and see if it really did hurt. So, and then after they came back for another examination to see that the atrophy hadn't really changed, and to fill out questionnaires and so on, then all of them, after that 1 month, got lidocaine, and they knew it was lidocaine, and then they had 2 more months to keep using it and see how well they could use it, and then they came back for a final check.
So we have here a non-hormone that's used only when you want to have intimacy by putting 4% aqueous lidocaine on a cotton swab, drip it up, put it in the area that hurts, leave it there for 3 minutes, take it out, use a lubricant, have intimacy, and the pain was pretty much gone away.
Yeah, the pain, at outset, women related that the pain score they would give intercourse was 8, when 0 to 10 was the scale, and 10 was the worst pain they'd ever had. So the median score was 8. When they used the lidocaine, it went down to 1.
Awesome. Thank you very much. This is very important for women to know about. Really appreciate it.
Yeah, appreciate your interest.